At this point, we're going to hear from the Minister, who unfortunately was unable to attend in person. So he's going to give us an overview of the Open Disclosure Framework and officially launch it now. So if my colleagues down the back could, I've been waiting for everyone to say roll it there, but I don't know.
Good morning, everyone. I'm delighted to welcome you all to the official launch of the National Open Disclosure Framework. Open disclosure, as you all know, is an open, consistent, compassionate and timely approach to communicating with patients and families when something goes wrong with their care. It's important to understand that when things do go wrong, patients and their families expect three things. First, to be told honestly what happened. Secondly, what can be done to deal with any harm caused. And thirdly, to know what will be done to prevent a reoccurrence to somebody else. I'm totally committed to improving the quality and the safety of our health and social care services by embedding a culture of open disclosure. With the support of my officials, I've continued to work to embed this really important, this really significant change in the culture of our health and social care services through my department's work on legislation and on the development of national policy. The Patient Safety Act 2023 provides the legislative framework for a number of important patient safety issues. This includes the mandatory open disclosure of a list of serious incidences and the external notification of these incidences. This mandatory requirement for open disclosure will ensure that patients and their families receive appropriate, timely information in relation to any incident that may have occurred in relation to their care. While the legislation sets out the legislative requirements in relation to the most serious incidences, the National Open Disclosure Framework promotes a clear and a consistent approach to open disclosure across the whole of the Irish health sector, following a patient safety incident or an adverse event. The development of the framework was informed by the policy recommendations of the Independent Patient Safety Council on Open Disclosure in Health and Social Care in Ireland. It's worth noting that prior to the development of this national policy framework, the HSE did introduce a national open disclosure policy in 2013. While this is an excellent policy, it only applies to HSE and HSE funded organisations. The National Open Disclosure Framework applies to all public and private service providers, service regulators, professional regulators, education bodies, and other relevant bodies and organisations. As we can see, everybody is included in our campaign to create a culture in Irish healthcare where open disclosure and where transparency are the norm. The introduction and the implementation of this national policy framework is a really important step forward in this cultural change. But health and social care service providers and agencies will be integral to initiating, growing, and sustaining this culture of open disclosure. The framework is designed to provide overarching principles. These can then be adapted to suit the needs of the various organisations that I've mentioned. I'd like to take this opportunity to personally thank each and every one of you and your organisations for the contributions you've made to the development of this national policy framework. I believe that working together to embed a culture of open disclosure within our health service and in your own organisations is going to bring a better caring experience to our patients and to their families. So thank you for everything you have done so far to get us to this point. And can I thank you in advance for all of the work you're going to do in ensuring that this important disclosure becomes a reality and becomes a norm right across our health services. Thank you all.